Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about serial extraction. And this is just my opinion on serial extraction, and it might vary from another orthodontist's opinion on serial extraction. But I've pretty much been converted. We were trained in residency that serial extraction was a viable way to treat patients, and it's done routinely. But now it's turning more into a very much old school, or I would consider it below standard of care. Can't think of any indications for it. Um, Basically, let me explain what it is. And you can understand why it was done, maybe in more low income communities up until maybe a couple generations ago. Because, I mean, the end result is straight teeth, but at what cost, right? First of all, that involves taking out the C's and D's. So, C's are your baby canines, that's right here, okay? Extracting those. Yeah, we do that sometimes, but we do it to help to prevent canine impaction. That's when I do it, right? I don't do it just to do it. And then you're also taking out the D's, which are these right here, okay? You take out those and those. And then when the fours come in, which is 5, the upper and lower fours are 5, 12. I have to remember the general dental numbers, excuse me for a minute, 21 and 28. So this, and this. Did I do that wrong? Sorry. This, and this. Yes. Sorry, it's super small on my screen, so I'm trying to see it. The 4s, not the 5s. So first premolars. You could do it with second premolars too, but I don't know that I would do that because I think you'd have a lot of tipping from the molars. So it's better to do it with first premolars. When those start to erupt, you pull those out too. And then, because those erupt before the second premolars come in. So that's why that works. And then in theory, everything comes in straight is the idea. So by relieving some of the pressure very, very early, very, very young. So you got to pull this at like 6, 7, basically, so that these teeth come in straight by taking over those spaces. But then what happens a lot of times is the 4s tend to sometimes get blocked out, or sometimes the 3s get blocked out, and other things can happen. And then you end up just by pulling these teeth, instead of allowing them naturally erupt, you affect some of the natural widening of the arches. So this patient is basically trapped with a very small intermolar distance at the end, and a very narrow arch because it didn't naturally expand, right? So yeah, they've got straight teeth and they're down 4 teeth, but at what cost? What's going to happen for the rest of their life? What is their risk of OSA? How's their tongue position? I have a lot of concerns with serial extraction over time. And there's very few studies. And this is one of those things where I think it's kind of funny because orthodontic studies to be put in orthodontic journals have to be approved by orthodontists. Well, who are these guys? Well, they're old guys. They're very smart guys. They're great. They're very talented at what they do, but they probably did a ton of serial extractions in their youth because if I was taught to do them, they were definitely taught to do them. And I think they're afraid to do these studies because I think they're going to get sued. So I think it's going to take a very young, motivated resident who's hopefully listening to this to do a longitudinal study, a retroactive study where you're going back and you're checking the frequency at a random cohort study of 1,000 patients and sending them for OSA screenings. People who've had serial extraction, people who haven't, and that's going to be tricky because we don't always know who's had serial extraction versus somebody's just had 4 bites taken out, right? They may not remember, did I have these taken out before braces or to have them taken out after braces? Did I have these taken out at a younger age or at an older age, So that's very, very tricky. And then you need to check them, in their 60s or 70s. Well, this is 50 years later, so I don't know how you're going to get all these records, But based on what I've seen, I see a correlation between 4-bite extractions and OSA. And not just me. Tons of general dentists see it in their practice. The correlation is crazy high. OSA is correlated with, it just is. I just know it is. I've seen it. Everyone else sees it. We all know it is. So I'm pretty sure serial extractions probably even more so correlated because the arches didn't have a chance to naturally erupt. I think it's probably worse. So, I'm just keep putting it out there because I figure the more I put it out there, my hypothesis that has not yet been proven, but it's just circumstantially proven in my head. I think hopefully less people will think that serial extraction is a viable way to treat patients. What do we need to do instead? We need, if the arches are narrow, change the diet, use expanders, naturally get the arches to the width they should be instead of just cheating and pulling out teeth, especially if the patient has a chance to grow. That's why it makes zero sense. I understand if the patient's in their 30s or 40s and the options are more limited because they're not growing, but this patient is 7 or 8. You're basically like condemning them to a life of possible health problems. And sure, you don't know, but you don't not know. So why do it, right? All right, so hopefully that was helpful and hopefully I changed a few minds here. That is my ultimate goal. If I can keep one patient from having a tooth pulled, and these videos that I make are all worth it. And I did tell y'all I was going on vacation, and I am very shortly. I said I wasn't going to do any more videos, but this one was too important and I needed to get it up. All right, thanks.